Welcome to Season 3 of the Love, Health, Prosperity podcast. We're super excited about what's going to take place in the podcast during the next year. We have some dynamic guests that are going to talk to us a lot about what mental health is all about. Subjects that are very specific, and we have professionals that are going to give their insights here in the border city as to why sometimes it's very difficult to break that stigma of mental health. But we also want to shed light to being able to provide people with coping skills, to be able to say, hey, you know what, I'm not ready to go see a therapist yet, but at the same time, I need to know some tools to be able to kind of relax my nervous system. That's always a good thing to do. And as you know, Love, Health, Prosperity is also about mental health, family, and shedding light to lifestyle also. Before we actually get started, though, we wanted to invite every single one of you guys to not forget about hitting that subscribe button, because we know that a lot of people are watching the show, but at the same time, they're not following us on social media platforms. And it works wonders for us and the algorithm to be able to reach more people when they see that people are actually watching and interacting with what we're doing. So without further ado, today I want to be able to introduce you to somebody who has been in the field of mental health for over 24 years and running. She's dynamic. She has her own practice, currently practicing from home and working on a project where she's going to be hybrid, which I'm going to let her talk a little bit more about her project. The subject today, though, is going to be something that's extremely important. We're going to be talking about trauma, or post-traumatic stress disorder. We're going to shed a little bit more light as to what it's all about and why is it that people get it. So without further ado, we have Iyali Lara Garcia joining us, and she is a licensed professional counselor. Hello, and thank you for joining us today.
Thank you for inviting me, Marcelo. I'm really happy to be here.
That is so cool. We're growing as a podcast, and we wanted to add a little more value as far as the structure of the mental health component to it. Because like I had mentioned, it's very difficult for a lot of people to seek out that information. Yeah, I can get onto YouTube and I can try to find a therapist and kind of try to find out about certain subjects, but there's nothing like somebody that we know from our community talking about these issues. So I'm really happy at the fact that you're here with us today. And lo mejor es que we're going to be able to kind of communicate this in a dual language.
Yes.
So that's the best part.
Yes.
Can you talk to us a little bit about how you got into the field?
Yes. So first of all, I want to start with a warning, because we're going to be talking about trauma. So even though I'm not going to be very explicit on the content, just talking about trauma can be triggering for some people.
Yes.
So if you're watching this or listening to this, just take care of yourself. If it's too much, you can pause, come back later. But always being mindful, right? Being aware of how you're feeling, and if it's too much, it's okay.
But I really
okay.
I love that you say that, because I think those disclosures, and sometimes I kind of jump the gun a little bit, and I think it's important to talk a little bit about people. You know, it's okay to take it easy a little bit. If something kind of hits home a little too hard, it's okay to, come back to this a little later.
Exactly.
How did you discover, being able to go at a certain pace with clients?
So it started when I was doing my practicum, starting with my hours, and then noticing that the regular or the traditional type of therapy sometimes didn't work. And then I thought, we need something else, or is there anything else? Is there something else out there? I was working at the crisis center with children, so I was looking for some other answers to address certain behaviors, and looking for certain answers and interventions that will be helpful to help these children. So then I found trauma informed, and that changed the way I saw things, and it changed my lens to see therapy in a completely different way. So then I started researching more and taking trainings. So then I changed to a nonprofit that it specialized in trauma. So that's where I got a lot of training, and that's when I felt that the type of training that I was getting was helping now the people that I was seeing.
Now, it's interesting that you talk about trauma informed. What was it like before? How was there a lack of empathy, or was there a lack of strategy regarding being able to get the message across to people? Because I do understand that sometimes we want to get into trying to fix the person's problems. That's hard. It's very hard.
Yes.
So
yes.
trauma informed is taking a couple steps back and using a little more empathy, I would say.
Exactly.
Right? Yeah.
And not only from the clinical environment, but since the person gets into the office, the secretary, the people, even making a phone call. So it's a different approach to be more sensitive. And instead of oh, what's wrong with you? Why are you answering to me like this? Or why are you upset? It's like, what happened? What happened to you that you're reacting in this way? And being trained in what trauma is to understand.
So what is trauma? And the reason why it might seem like a silly question for a lot of people, probably. Well, we all know what trauma is. Not necessarily, because it's kind of different for everybody. I do know that sometimes we can be a little too rough with people who have experienced trauma. And the first thing that comes out, especially when we're here in a border city, is like, come on, shake it off. No pasa nada, de veras. No es cierto. Y como exageras. Eso realmente, pues mira, al rato se te pasa. Right? So, I mean, what exactly is trauma, and in what context would you say that you see trauma the most?
So that's a very important question. So it's important to identify what is it trauma? What's trauma? So trauma is the body response and the emotional mental response to an adversity, to a distressful experience. And you said it's unique. Because what might be traumatic for you, maybe it's not for me. So it depends on different factors, right? And my upbringing, my stability, my emotional regulation, and how I perceive what I'm experiencing. So it's a very unique experience. So not everybody that experience an event that is distressful is going to develop trauma.
Yes, that is true. And I think that you have a really awesome point when you're saying that, because let's go ahead and say we're not talking trauma, we're talking about depression. And we all think depression is all the same, but you can get 10 people diagnosed with major depression and you would work differently with all 10 of them, right? Same thing with trauma, I would imagine, right?
Yes.
What's been the most difficult thing for you having to work with trauma as of right now?
So you asked me before, how it was the approaches before,
Yes.
right? And before maybe it was okay, so tell me what happened. And then probably opening up, and then the client goes home dysregulated, maybe feeling worse that they felt before. So that's why the trauma informed is so important to know, and the new interventions that are, and we'll talk about the therapies that are focusing on how to work with a client so then that doesn't happen. Right? So there's different levels, and some people that experience the trauma maybe are able to function and in a way still a little bit dentro, within the window of tolerance of how I can handle. And some other people might be very dysregulated. and outside the window of tolerance, like very anxious, a lot of overwhelm, like anything can throw them off, and or the opposite, very shut down.
Do you see that often?
Yes.
Yeah.
Yes. So it's how to work with each one. Because trauma is unique, then I can just work with everybody the same way. So maybe a client, it's meeting the client where they are.
Okay.
And I like this word, this phrase in Spanish, pero no empujes el río. Right? It's following their own pace.
Es como merging, como quien dice.
Yes.
You merge
Yes.
into wherever you feel they may
Yes.
possibly be.
Yeah, if they're not ready to talk about it, then we work to help straining that core then so they can talk about it without pushing.
So that's, I would imagine that's where the importance of building rapport comes in, right?
Yes.
What's it like for a client to go into your office to be able to seek that therapy? And how do you make them comfortable?
So just by thinking about taking a phone call to make an appointment, it's a big step because it's not an easy decision. Sometimes it takes years to make that first step. So that's why it's so important to be aware of that. And in building safety, so knowing that starting with your environment, knowing that the office that you're in, it's safe, and starting knowing that probably is going to be difficult for the client to trust you. So it's implementing all the skills that are going to help to build that trust.
Yes.
Like unconditional, positive, yes, regard, just all the therapeutic skills and listening and validating what they feel, not judgmental.
Yeah, I like the metaphor that you use of being able to merge into their trauma, because a lot of times it is hard for them to open up. And then you see them walking into your office, and then you make that connection, which is important. And then you begin to ask them open-ended questions, I would imagine, to try to get them to open up a little bit about what it is. Right then and there, when you start doing that, are you using some sort of technique that's going to help you even build more rapport with the client? And that brings me to the next question: what therapeutic approaches are you using to be effective with the client?
So again, with the trauma inform is since the beginning of the first encounter is letting them know, right, that what we're going to do. So they know exactly. So, and usually I start like, I'm going to be asking you some questions, and that might trigger intense emotions. So let me know if it's too much so we can stop, maybe do some breathing. So being very mindful about that.
Okay. And a lot of people do talk about breathing. Iyali, can you talk to us about how important it is to teach your client, especially if his nervous system is altered, why it's important to be able to know how to breathe and use those skills?
Breathing helps to calm their nervous system down, but it's not as simple. Sometimes they tell me, no, breathing doesn't work. And it's a skill. So just like any other skill, we need to practice. And I say that it's like compound interest, where you don't see the benefits like right away, but it's going to be in the long run where you start noticing the difference, right? So by implementing not just the breathing, but implementing as a lifestyle, like taking time to breathe like even setting alarms, right?
Yes.
Or some like the smartphones that they tell you like to read, sometimes we ignore them, but taking that time to just be aware of that. But with trauma, this is what it's very important as clinicians to know, because just even breathing can be triggering because of just feeling the sensation.
Okay.
So
can you go a little bit more into that? Because I find that fascinating right there. How the breathing, right? Even though it's a coping skill, how could it trigger also
yes,
some people?
Because there are protective behaviors, and the nervous system, when it's in survival mode, our heartbeat is pounding very fast, and it's difficult to catch breath. And with trauma survivors, they also learn protective behaviors such as, or a protective, let me see how would I phrase this. It's not a behavior, but a way of, it's disconnecting from sensations, depending on the trauma. So because sensation might trigger memories. So that's why we need to be very gentle on bringing that, and that's why it's not just like, oh, you're safe here, because they might know that they are safe in the environment here, rationalizing it like, yeah, I'm not in danger here, but it doesn't feel safe. So we go little by little.
You kind of work them in. And the thing with the breathing, I would imagine also, you had said it was as a part of a lifestyle as well. So it's not just when you're feeling the crisis, perhaps it's going to take place, or anticipating it. It's also being able to be mindful of when it can potentially, uprise again, right? Would you say that's one of the things also?
Yes. So I like to see it in a way of like, what do you do for yourself to help you to feel better daily? What are the activities that you do since you wake up to help you keep maintaining yourself, like keeping you're regulated? Maybe meditation or walking that you do daily. Things that you can do maybe every 2 weeks, once a month, getting together with friends.
Yes.
Going to watch a movie. You don't do that every day, but you can do it
as a part of a practice.
And the things that you do in moments of an emergency. When you were triggered, when you got a bad news about something, when you are dysregulated and you feel that you need to help yourself to go back to feel better.
All right, that's awesome. That's really good. How important do you recommend that one of your clients follows some sort of routine?
So about the question about the treatment, so we start with building resources.
Okay.
So we don't start right away like processing, because we want to have, for the client to have the coping skills, and being able to regulate when they feel triggered. So then we start with giving them like the practices that they can start doing it, like different breathing techniques, different like tapping, different coping that will help them to being able to regulate in the moment.
How does tapping help with regulating emotions for people?
So I think it is important to, before I answer your question, just like trauma is unique, not all coping skills help to everybody, right? So you need to find what helps you.
Okay.
So I find, for some clients, tapping is being very helpful to help them soothe and release emotions in specific points. And some clients is like, oh, this is too much, or I can't do this. And then we find other ways. So I teach them a coping strategy, and then I tell them, okay, practice, let me know how it feels. And then we go from there, and they tell me this one was very helpful. This one it's not, or this reminds me of this something that has to do with the trauma. I can't do it. So then we look for what's the best techniques for each client.
Okay. Would you consider those being the basic essential ways of coping with trauma? The breathing and the tapping. What would be something a little more, say you see that a client is severely suffering from trauma? What other methods would you use in your practice to be able to help them?
So I see it in two ways. One, the coping, that it helps to manage the symptoms. It doesn't heal it, but it's so important to have your tools, right? And then the work that we do in therapy, that we go more in depth to processing the trauma. So combining those, then that helps so the client can start feeling better.
And that's, is it following, again, you merging into what the client is going through at the time then, right? Can you tell us what role, for example, I became very curious about that therapy technique, EMDR. Can you shed a little bit of light onto that?
Yes.
And how it works with trauma?
So that's one of the interventions. That is one of the therapies. EMDR, it stands for eye movement desensitization and reprocessing. So, so there's two types of interventions: the up-down, like up-down, bottom, that are like cognitive behavioral therapy, for example, that helps to process, to make sense of what happened here, and I'm trying to think about, it's not restructuring, but to reframe what happened, right? And there are interventions that are bottom up. So working with the body and with the effects of trauma in the body, so then you can process. Okay. So EMDR is bottom up, and it uses also like the cognitive processing. So it's gentle, and it helps build the resources that the client needs to start processing. So the client, we do a timeline, and we identify memories. So it doesn't exposure the client to the whole event, but an image. So then we process that. And it uses bilateral stimulation to help the brain process what it naturally does, that it didn't have the opportunity to do because of the trauma. So using the bilateral stimulation, like maybe the butterfly or the eye movement, to help then process with the guidance of the therapist. And that's one of the interventions for trauma.
That sounds like a fascinating intervention.
Yes.
Whenever I read somebody or someone talk about it, just as yourself right now, I find it amazing how there's some interventions that people could use, and when you go to a therapist, that they can perform, that helps relieve that those traumatic memories, for sure.
Yes.
I wanted to ask you also about creating a safe and supportive environment for somebody who's been, somebody who's gone through trauma. But before you answer that question, I failed to ask you, what would be some common examples of somebody who had gone through trauma? What kind of things have you heard in our border city regarding that?
Yes. So traumatic events can be childhood trauma, sexual abuse, physical neglect, verbal, emotional abuse. It can be also being in a war, a survival of a war, being in an accident, a car accident, having a medical or an illness, medical procedure or illness that was traumatic, immigrating, right? I think that's common here in our border. Shooting.
So like
the
street
shooting,
violence and stuff like that.
Street violence, the Walmart shooting, the violence in Juarez. Those are examples of traumatic events.
Would you say abandonment, it could be traumatic
Yes.
also?
Yes.
Okay. So these are excellent examples. Thank you for shedding light to that, just so that people have a context regarding trauma. So the environment that we want to create as family members who perhaps have somebody who we know has been through a traumatic event or has been diagnosed even with post-traumatic stress disorder. What kind of environment would you say it'd be best to try to have for them at home?
At home. A lot of understanding. So for the family members to be trauma informed, because we tend to judge behaviors and not understanding where those behaviors are coming from. So the person is having already difficulty dealing with the trauma, and then also not having that support. It's adding to the problems, to the difficulty. So having a good support system is very important.
That is very important. Would you say that the majority of the population struggles with something so basic as support at home?
Yes. I don't know percentage, but I know that it's something that I don't know if the majority, I can say that. But it does happen. I think in our, I'm sorry.
No, it's okay.
I think in our community, we have that support because of our values.
So values play a big role.
Yes.
Also.
Yes. Okay. Yes. So the importance of family. And I think that's a value in Hispanic communities.
Most definitely. Yeah. And it's definitely a way to help people out, especially bringing somebody home where they know that they have, like in an office setting, unconditional positive regard.
Yes.
That's so important. But as far as being able to redirect somebody to get a little more information regarding the subject, what's been your best experience for referrals or being able to have continuous treatment after you've seen them as a patient and you've watched them blossom? What are some of the ongoing therapies that you recommend for them so that they can continue with in their mission to cope and heal?
Yes, continue with the coping strategies, using the cognitive and the emotional strategies that they learn to continue, and always knowing that if at one point they start struggling, they can always reach out to mental health professional to help them, to receive help. That they are not alone. They don't have to do it alone.
Yeah. So always let them know that they have support.
Yes.
There's always something so soothing about talking to a therapist. The voice, the way you express yourself, the way you have a structure. And I think that helps tremendously, because there's a difference between being able to, they say it in our culture a lot, they say el desahogo a lo que viene siendo la terapia.
Yes.
What is the difference between that? That'll be my last question, because I know you hear that a lot. Mira, es que tengo que ir con tal persona para que me terapeen, right? Which translates to I have to go with a certain person to so that they can give me therapy. But technically, they're not talking about therapy.
Yes. Cuando te desahogas, people tend to like tell you what to do, or like, oh, don't feel like that, or don't be sad. Like if it's like a switch that you can just change,
Turn
right?
on and off, yeah.
So I think that's a difference. So in a therapeutic setting, then you allow that person to express, to verbalize what they're feeling. You don't tell them what to do. I mean, you teach them coping strategies. And that's why those interventions like EMDR, lifespan integration therapy, there are structure, there are therapeutic techniques that are helpful to help the client process the trauma. It's not just sitting and listening. Sometimes they need to. Sometimes there are sessions where they just want to talk, right? They feel like, I needed to vent. But when we're processing the trauma, then that's why we use those specific interventions.
Oh, perfect.
And other ones, right? Because there are other interventions.
Yeah, we can go on and on about the subject. But one thing that we have for sure and very clear is that a person that's going to seek your services is definitely going to be in on being able to be treated, because it's been a pleasant conversation. Believe it or not,
thank you.
It's already been 30 minutes.
30 minutes. It went really quick.
But we want to let people know where they can find you.
Yes. So they can, I'm in my website, so they can send me an email there. It's iyalilara.com. IYALI Lara.com. They can also find me on Psychology Today.
That's where we found you.
Yeah. So,
very effective.
Yeah. So they can call me or send me an email through, and also on my social media.
Perfect. Thank you for that. Last question. Say something inspirational, motivational for the people that are listening to us right now to wrap up the show.
Una frase que me gusta mucho es que no es lo que te pasa, sino lo que haces tú con lo que te pasa.
Beautiful. Awesome.
It's not what happens to you, it's what you do with what happens to you.
Yes. Taking action.
Yes.
For sure. Again, I want to thank you for being on the Love, Health, Prosperity podcast.
Thank you.
And for those that have been watching, don't forget to follow us on social media. We thank you guys for all the support that you've been giving us. And once again, you guys are in for a special treat for season 3 of the LHP podcast. As you can see, we have dynamic people that are going to be providing us with really good information on future episodes. We'll see you next week.